Right, so today we're going to talk about aging and mental health. It's kind of a pretty high level overview, so you'll forgive anything that seems more than simplistic. We can only cover so much in so much time. Um, so the World Health Organization has said that by the year 2030, 1 in 6 people will be aged 60 years or older. 14% of adults age 60 and older currently live with some type of mental health disorder. And about 20 to 33%, depending on the region that you look, health disorder in the last year. And while most people of age 60 and older are going to have relatively good health, obviously many are at risk of developing mental health conditions, depression and anxiety being the highest rates of those. There's also higher risk of developing cognitive impairment, both with and without dementia. And that rate actually, interestingly, falls in about that same range as you see with the mental health disorders, anywhere from 23 to 34%. Many individuals in this age range also experience reduced mobility, chronic pain, frailty, dementia, plenty of health problems for which they might require long-term care. And as people age, they're more likely to experience several conditions at the same time, which can clearly cause a significant strain on quality of life. So depression is something that we see far too often in kind of aging populations. And depression may act as a risk factor for developing some physical illnesses, and vice versa. It can actually exacerbate disease progression. So some studies have shown that with depression comes a 1.5 higher times risk of developing 29 separate conditions across various organ systems throughout the body. A comorbid depression is associated with a reduced quality of life, higher risk of all-cause mortality. When comorbid with cardiac issues, it presents itself as a higher risk for cardiac mortalities specifically, a higher risk of having a cardiac event within 24 months. And amongst elderly populations, depression is correlated with a higher number of medical problems, poor cognitive status overall, lower socioeconomic status, and more severe disability. When we look at comorbidity of depression amongst medical conditions, you see that it's pretty prevalent in quite a few. So strokes being a pretty high rate of comorbid depression, myocardial infarction, COPD, hypertension, osteoarthritis, chronic pain. Others are on the list, but these were kind of the highest of the ones that I could find in the studies that I was looking at. Pain severity specifically is strongly associated with worsening depression in the elderly, which is seen more often amongst females. Interestingly, there were higher rates of depression amongst men with Alzheimer's disease than there were amongst women with Alzheimer's disease. So that we're seeing a little bit of gender differences as people age with the various comorbid conditions. And when we look at chronic pain, there are direct correlations between chronic pain and depression in all ages. Chronic pain absolutely increases the risk for depression overall. Individuals with depression are 3 to 6 times more likely to experience chronic pain. And endocrine, digestive, vascular diseases with a comorbid moderate to severe depression actually showed an increased risk for the need for hospitalization due to one of those disease states. So a really complex, bidirectional and kind of integrating pathway for these disease states and then the impact of it. When we think about all of this, it's also important to consider suicide. While older adults comprise just under 17% of the global population, they make up approximately 22% of the suicides. In 2022, among the nearly just over 49,000 suicides that took place in the US, 10,433 were attributed to people age 65 and up. Older adults tend to plan suicide more carefully. They're more likely to use more lethal methods. Among those who attempt suicide, 1 in 4 older adults will be successful in their attempt, compared to 1 in 200 youth individuals. And even if older adults fail to be successful in their attempt, they're much less likely to recover in a meaningful way, leading to increased risk of frailty or underlying health conditions. In 2022, we saw the suicide deaths increase amongst individuals 65 and up, with men ages 75 and older having the highest overall rate of deaths by suicide. And when you look at elevated risk, and we've talked about this in this group before, there's lots of categories of individuals that are shown to be at a higher risk. So males over ages 75, those of an LGBTQ population, Indigenous Americans and white Americans are at higher risk. Socioeconomic and geopolitical factors obviously play into, an elevated risk in chronic disease, disability, and mental illness. When it comes to cognitive impairment, a 2021 study showed that older adults with mild cognitive impairment and dementia had a higher risk for suicide, and declines in cognitive function can absolutely affect a person's decision-making abilities and increase their impulsivity. I know that I've used this quote in this program before, but I think it's an important one. When we really think about suicide, it applies to all ages and all populations, because suicide is not always about death. It's not really about death. It's about a desire to end suffering. And often we are not looking at the source of the suffering, where if we're looking at that, we might be able to prevent individuals from thinking that that is the most logical or best way to resolve said suffering. So what contributes to poor mental health amongst the aging populations? It can be a lot of things. This is, a list that I think seems fairly common sense, but bereavement, so when you're losing friends and family members, loss of a sense of purpose. So after retirement, many people find a sense of purpose in their jobs, or once kids grow up and go and live their own lives. So you're having that day-to-day meaningfulness is sometimes something that's lost. Financial stressors obviously can contribute to poor mental health. Loss of sense of self-sufficiency, so the more that you need to rely on other individuals. Loneliness and social isolation. 1 in 6 older adults experience some form of abuse, whether that is physical, verbal, psychological, financial, or sexual abuse, and neglect would be included in that also. And that seems like a way higher number than it ever should be. Caregiving for a spouse can be very straining. I don't know how often we talk about caregivers of any ages, but it is a challenge for folks and can definitely impact your mental health, poor physical health, and then the presence of neurological conditions. Social isolation is a pretty big one. And there's lots of context that we could talk about this in. I know that this group has talked about it before, but just looking at the elderly population, the UN has estimated that 20% of the elderly population globally is living alone in the community. And that proportion is even higher in more developed countries. So the more potential resources there are in the community, the more likely it is that elderly individuals will live alone within that community. In the general population, both social isolation and loneliness are significantly associated with an increased risk of all-cause mortality and cancer mortality. And with living alone, it certainly increases your risk of being more socially isolated. It's not a guarantee, but it's certainly a risk and something that needs to be considered. Social isolation overall can be associated with sedentary lifestyle, smoking, obesity, and risk of developing disease, and something that we should be looking out for with elderly populations. So addressing or preventing poor mental health amongst aging populations, there's a wide variety of things that we could do. A lot of them are really systemic. So I think that's something for us to very much keep in mind. So we need more mental health providers that are both trained in geriatrics and able and willing to accept Medicare as a payment structure. From what I've read a bit of and even heard anecdotally, there are less people willing to take Medicare as a payment method. That is going to directly impede access to mental health services. So we need more people to be willing to do that. Any type of systemic measures to reduce financial insecurity for aging populations, ensuring that there are programs to ensure safe and accessible housing, safe and accessible public buildings and transportation. Finding ways to enhance social support, enhance social connections, building social connections, keeping people I mean, the connection is such an important piece of being a human that whatever we can do to help that is going to help prevent and address some mental health concerns amongst the aging populations. Support for healthy behaviors, so like a balanced diet, being physically active, avoiding use of substances that could harm your body, and obviously trying to get more integrated care across the board. So there is a World Health Organization program called ICOPE, so Integrated Care for Older People. There's a link to it in the citation slide, but it looks at a continuum of care that helps to reorient both health and social care persons towards a more person-centered and coordinated model of care. So it's something that communities could use. And just general overall health and social programs that can target those who live alone, live in remote areas, those who live with chronic conditions. I found a meta-analysis that looked at one specific method of potentially addressing and or preventing some mental health, poor mental health amongst aging populations, and it was looking at yoga. So it looked at a variety of studies, and really what they're saying is that while pharmacological treatments for mental disorders are useful, obviously, they can't meet all of the needs. I mean, there is no one pill that fixes all of the things. So we have to figure out other things to do too. And whilst there are traditional therapies, cognitive behavioral therapy, other types of therapy that can be very beneficial, a number of studies have actually looked at yoga. So an exercise that engages both your physical body and has a higher cognitive demand. So things like yoga and Tai Chi seem to be dually beneficial for both body and mind. 8 studies looked at cognition, 3 of which reported significant improvement in attention. A number of them, 6 of the 7 looked at executive function and showed significant improvement there. And 3 of 4 looked at specifically at working memory, and those all showed improvements there too. 9 studies looked at mental health. So they showed a significant improvement in anger, self-reported anger, anxiety. 5 of 8 actually reported improvement in depression. 1 reported reduction in stress, kind of generally stress, and 1 reported improvement in overall mental health. So it looks like engaging folks in some type of regular yoga practice could be beneficial both physically and mentally. And obviously, our standard universal screening for depression and suicide. This is something that I learned when my mother had some cardiac and medical issues a number of years ago. I knew then that there was a high comorbidity between heart conditions and depression, and never once was she screened for depression or suicide. And to me, that really seems like something that should be a universal screening for in hospital systems and primary care as follow-up. Knowing the warning signs, being willing to ask, being there to listen and support without judgment, helping to connect, calling, texting 988, which we've heard from the 988 folks recently. And, as we know, following up the next day and sometimes the day after that can be super helpful. So a citation slide that you can't read, but the links should be all very accessible within this slide, and the slides are on iEcho. And at that point, I will stop my share.